discussion on endless loop tachycardia and repetitive non-reentrant ventriculoatrial synchrony. Endless loop tachycardia is the commoner of the two types of pacemaker-mediated tachycardias, the latter being repetitive non-reentrant ventriculoatrial synchrony. Endless loop tachycardia is repetitive reentrant ventriculoatrial synchrony. In RN-RVAS, pacemaker does not sense the retrograde P waves. In this form of ventriculoatrial synchrony, the atrial stimulus is ineffectual because it falls within the atrial myocardial refractory period generated by the preceding unsensed retrograde P wave. This leads to a long atrioventricular interval, and when there is a relatively fast lower rate or sensor-driven rate in DDDR pacing, leads to atrioventricular desynchronization arrhythmia with unfavorable hemodynamics. Here is an ECG with paced rhythm and retrograde P waves. It can be seen that VA interval is short and AV interval is long, which gives rise to unfavorable hemodynamics. In fact, there will be regular cannon waves in this case of VVI pacing. In pacemaker-mediated endless loop tachycardia, the pacemaker actively participates in the tachycardia circuit. This occurs only in dual-chamber pacemakers. The ventricular depolarization is conducted retrogradely and is sensed by the pacemaker circuitry. This triggers a ventricular pacing stimulus at the end of the programmed AV delay. The ensuing ventricular beat is again conducted back into the atrium and the vicious cycle continues. Final result is a tachycardia at the upper rate interval of the pacemaker. The tachycardia is usually triggered by a ventricular ectopic beat, which fortuitously has an appropriate timing for initiating the vicious cycle. Sometimes endless loop tachycardia can also be initiated by an atrial ectopic beat occurring within the post-ventricular atrial refractory period. Pacemaker-mediated endless loop tachycardia is usually terminated by magnet application, and it can be prevented by programming the PVARP appropriately. Though usually the tachycardia is terminated by application of a magnet, one unusual case in which it was induced by magnet application and persisted despite repeated removal and reapplication of magnet has also been reported. If a pacemaker programmer device is not available, pacemaker-mediated endless loop tachycardia can also be terminated by chest wall stimulation to inhibit the ventricular channel of the dual-chamber pacemaker. A study evaluated chest wall stimulation by an external pulse generator used for transcutaneous pacing, provocation of myopotential oversensing, and chest thumping for termination of endless loop tachycardia. Chest wall stimulation was applied in 10 patients with unipolar and 10 patients with bipolar DDD devices during endless loop tachycardia and was successful in terminating all cases. Myopotential oversensing could terminate endless loop tachycardia in 6 out of 10 cases, and chest thumping terminated 4 of 6 cases. Occasionally, pacemaker-mediated endless loop tachycardia gets converted to RN-RVAS and is one of the reasons for magnet unresponsiveness. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.